welcome to the Eyecare Experts. I'm Troy Bell, Jean Teresa, and we have with us our general manager, Kat. And we're talking today about one of our favorite things that happens once a year, Doctors with a Heart. And before we get into that, I will say when I first joined Teresa, and I've been with him, I think 12, going on 12 plus years, one of the things he had to agree to was carry on and continue Doctors with a Heart once a year, and that's how much it means to him. And so we're going to get into that. What does it entail? You know, how can it affect you? How long you been doing Doctors with a Heart for how many years?
Actually, our advertising lady corrected my number.
Yeah.
So this year would be 38 years. And I'm very happy to be doing this. This started during the Reagan administration, to show you how long we've been doing this. And the initial idea, which I've kept up, was people come in and get free eye exams, they get free glasses, they get free contacts if they need them, they get free drugs, they get free medical care, and if they have conditions, medical conditions that need ongoing care, then we see them sometimes at a small charge, but usually at no charge. And so we've continued that. We have a rule that you can't come in 2 years in a row, otherwise we'd be doing the same clientele over and over. I think we've been very successful. Last year we were a little thinner than what I expected, but this year we're going to make that up and then some. And what is most intriguing about this year is we have 2 new locations to see these patients. One is our newest office at Baptist Hospital at Baptist Way, the Henderson building, right opposite the emergency room. And the other one we have, which will also be seeing patients, is in Fairhope, Alabama. And we'll have that fully staffed and ready to go on February 14th, Friday this year.
Well, Kat, go into it as far as who qualifies, what the program is, and what all entails.
Okay, so I like to go ahead and start with saying that we truly enjoy this. This is probably all our staff and all our doctors' favorite day of the year, where we are giving back to the community. So patients that do qualify for this are patients without any insurance, low income, and they just need help, you know. Essentially what the process is that you'll just call any one of our locations, get your name on the list, someone will call you back to do a quick phone interview to see if you qualify, and if you qualify, we'll go ahead and schedule you on Friday, February 14th. So I'm going to piggyback to what Dr. Teresa was saying. Typically, you know, this year we have added 2 new locations that is able to help the community, you know, one being in Fairhope, Alabama. That's one of our newer locations. So Fairhope has never had a doctor to provide these kind of services, so we're excited to bring that to the community in Fairhope, Alabama. And we've also added our location at Baptist Hospital. So Baptist Hospital, of course, is at the Henderson building. So give us a call at any of our locations, and I do want to go ahead and give out phone numbers and kind of give you ideas of where each location is. Sorry, I have my phone.
Oh, you're fine. Well, the one thing I was going to say before you do that is this year we've actually opened it up sooner, I think, than any other year we've done that. So if you're seeing this podcast right now, the phone lines are already open. Go ahead and give us a call, like Kat said, at any of the locations. Go ahead and get you on that list, because the earlier you call, the earlier you get on that list, the better the chance is that we can see you this year if you meet the criteria.
Yeah. So obviously we have our location in Pensacola on Palafox across the Sanger Theater. That phone number there is 850-434-2060. Don't let parking discourage you from even wanting to come to that office. We have a parking lot that's right behind our office that we will validate the parking. I understand parking is an issue with a lot of our patients. They worry about paying and everything like that. Just remember to get your tag number when you check in. Go ahead and type in your tag number at one of our iPads at the front desk at Halifax office to go ahead and validate your parking. So we will pay for your parking, so don't worry about that. Again, that phone number is 850-434-2060. Our other location is in Milton, Florida. That's on Stewart Street. It's on the same street of Milton High School. That phone number is 850-623-0319. Again, it's 850-623-0319. We also have a location in West Pensacola on Fairfield and Lillian Highway across the CVS. That location, that phone number is 850-456-5059. Again, it's 850-456-5059. We also have our Foley location that's on Mackenzie Street. That's in Foley, Alabama. So that phone number there is 251-943-5115. Again, that's 251-943-5115. Again, I mentioned Fairhope, Alabama. That's our newest Alabama location. We're located in the shops at Fairhope Village, the Publix shops. So we're kind of like on the end where next to the dentist, there's a VIP care. That location's phone number is 251-383-2052. Again, that's 251-383-2052. And our very last location that we are taking applicants for this program, that's at our Baptist Hospital location. That's in the Henderson building. That phone number there is 850-407-9474. Again, it's 850-407-9474. So the phone lines are open. All our staff are taking names and we're interviewing. This is a first come, first serve. So give us a call. Go ahead and get your name on the list so we can see if you qualify for the program. Again, this is like one of our favorite things that we like to do. We have about 12 doctors in our group that volunteer their time to participate in this program where we do free eye exams, free glasses, free care, even your follow-up visits. We'll continue to see you.
So when you call one of those numbers, and you can go to our website too, teresaoptical.com, and it's all listed there as well. Just let us know that you're calling about the Doctors with a Heart program. And again, like they've all said, this year it's on Friday, February the 14th. The one thing I would say, and I know from years of doing this, is some patients don't know if they qualify. Sometimes they find out they have insurance that they didn't know they had. So if you do not know, or say, hey, give us a call. Give us a call because A, you would either qualify for the program, or B, you may find out you have a vision or medical insurance you didn't know that you could use. So either way, it's a win-win. So give us a call.
Yeah, I think a lot of people don't realize even if you have medical insurance, we are still able to bill a majority of their medical insurance for an eye exam. So in that case, we would go ahead and schedule you for an eye exam anyways.
Well, this is a chance certainly for us to give back to the community, and I think that's one reason Teresa certainly loves to do it every year. I know I've seen patients, hey, sometimes we're one medical emergency or one, laid off work from being there ourselves. So we certainly want to help anyone we can. We've seen patients who have come to see us with Doctors with a Heart years ago, and now they're back on their feet and they have a different insurance or a medical insurance, and now they're still seeing us with that. So we'd love to see these patients, whether it's one time for this program, or maybe we see you years and years, going forward.
I agree. It's very heartening to see patients get on their feet and come back and see me. And I enjoy doing that even more. And they never forget, so it's a good thing.
And I know, just thinking of the last 2 or 3 years, patients that I've seen, and I know you can attest to this too, some of them come in and they come in because they want a pair of glasses where they can see, but certainly when we look in the eyes, maybe they have glaucoma, or maybe one year I had a patient who, had bleeding and was going to have like an ischemic event in the back of the eye, and he needed an emergency visit to to get that taken care of. So anything, if you're having bad headaches, your vision is wonky, you're not seeing, you got pressure, it's a reason to come in and see us, and we certainly want to take care of you.
We take the economics out of that equation, so now we can just deal with symptoms and signs of disease. And that's important for you to take advantage of that, and hopefully you'll hear about this and act.
And I also wanted to put in there, whenever we say free eyeglasses, I don't want patients to feel like, oh, it's just going to be like an ugly pair of glasses or like a budget pair of glasses. These are frames that are donated, so they are great. They're branded frames. They're not from 1992. These are current frames that a lot of our vendors have donated to help the cause. So you get to pick out your own frame. I did have somebody ask me this morning if they had to pick like the same basic frame that everyone has, and I said no. You actually get to pick out your frame. So just wanted to throw that out there because I did get that question
Yeah,
this morning.
I mean, you see, pick out what frame you want. We'll get that prescription in there. And typically, certainly you wouldn't leave with it that day, but we have to send it to the lab to get it made. What is it we talking? How long usually on that?
Because of this program, we see more than we typically see in a day. We try to schedule 50 to 60 patients a day at each location. So with that said, typically glasses take about 2 weeks, but we try to tell patients that it may take up to 3 weeks just because of the volume of patients that we are seeing and the volume of glasses that we are ordering just for that day.
And how do they get their glasses? Like, say they come in for this program that day and pick out, how would they get their glasses once they're done?
So in a couple weeks, we'll give you a call or we'll send you a text message, depending on what type of communication you want to opt into. And then we'll let you know when the glasses are ready. You just come pick up at any time. You don't need an appointment or anything like that. And we'll adjust it. We'll help, troubleshoot it if you're having any issues. We'll clean them, anything that you need, we'll take care of you.
The last thing with that, we mentioned a lot of locations. Some patients will know and say, hey, I live close to this office, it makes more sense. Other patients may not know which office is closest to them or which one, is easier to them to access. If you give us a call, we can work that out.
We'll definitely work that out because the first step is just getting your name on the list. And then the next step is we'll give you a call to try to do the quick phone interview. At that time, we'll see where do you live, what location is closer for you, and then if you're closer to this location or that, we'll definitely get you scheduled at the location that's closest for you or convenient for you.
I think it's important to emphasize that these people will get the same glasses that all my other patients get. The frames will hold up. You should get your year or two out of these glasses and look just as good as anybody else does.
So this is for you guys. So all of you, certainly give us a call. We want to see you. In years past, sometimes we booked out, some we haven't, but this year we opened up sooner because we want to be as full and as busy as we can that day. Well, thank you for joining the podcast. Again, Doctors with a Heart program. We want to see everybody. Go to our website. Kat went through the numbers. We'd love to see you at any of our locations. Thank you for watching.
Thank you. Give us a call.